Hello, welcome to Smile with Pediatrics. Today we'll be looking at some clinical examples of how to apply the EASY protocol. Kaka is a 5-month-old boy who was seen in the emergency department earlier in the day and treated for an upper respiratory tract infection on outpatient basis. However, Kaka remained in the ED with mother because his elder sister was on admission and mother had to be with her. While in the ED, he vomited 3 times, was less playful and did not tolerate his oral drugs, so the doctors decided to admit him. The EASY bundle was administered thus. Cultures were omitted as they were not considered pertinent. Urine output was normal. Rapid malaria test was negative. The bedside glucose was also normal and his vital signs check revealed that he was subfebrile. His respiratory rate was 56 breaths per minute and his pulse rate was 170 beats per minute. The other vital signs were normal. The interventions in the EASY bundle were merged with the algorithm. So Kaka got regimen 1 of the algorithm because he had no B signs, and in this regimen he received the green arm due to the absence of crackles. Thus he received 1 crystalloid bolus of 20 ml per kilogram and was re-evaluated thereafter using the monitoring flow chart. Using plan A of the flow chart, no further boluses were given because his vital signs had normalized. So glucose infusion was commenced at 100% maintenance. On subsequent review, Kaka had stopped vomiting and his urine output was still normal. However, his appetite remained poor, so the glucose infusion was maintained. He was discharged home the following day as his appetite was progressively improving and he was now tolerating his oral drugs. He had also become more alert and interactive and vomiting had completely resolved. In this example, we observe how only relevant aspects of the EASY bundle are selected and administered, and how the bundle and algorithm are merged and carried out concurrently. Kuku is a 4-year-old girl who had been sick for 6 months and presented to the ED today with complaints of abdominal pain and weight loss, generalized edema, poor appetite and diarrhea. The fever and diarrhea started 2 days ago and she last passed urine yesterday. Since the onset of her illness, she had received treatment in other hospitals. On examination, Kuku was very pale, looked very weak and had generalized edema and high-grade fever. She was also very thin. Her respiratory rate was 24 cycles per minute and she was mildly dyspneic with no crackles. Her extremities were cold, capillary refill prolonged, pulse rate was 100 beats per minute and her blood pressure was 70 on 50 millimeters of mercury. With the EASY bundle, hypoglycemia and oliguria were noted. So she was therefore given an intravenous bolus of dextrose solution for hypoglycemia, as well as oxygen and antimicrobials. And because she had a B sign, in this case edema, she received regimen 2. Due to the absence of crackles and any of the critical signs of regimen 2, she received the first arm of the regimen and thus got fluid resuscitation, and in this case with blood. Monitoring was done using the monitoring flow chart and she received plan A where she was administered a dextrose infusion as maintenance fluid. As she was still in shock at the time of re-evaluation, an inodrop infusion was promptly commenced. Her vital signs progressively improved and further definitive investigations and treatment followed thereafter. This example highlights the use of regimen 2. Note that rapid fluid expansion is not often recommended for cachectic or chronically ill patients like Kuku. Thus, Kuku did not have multiple fluid boluses. Rather, cardiac support was commenced early. These examples show how straightforward the EASY protocol is in practice. And as we apply the EASY bundle and algorithm, the hallmark of the protocol is always evidenced, which is individualized patient care. Also, EASY always accommodates the doctor's expertise and judgment, and thus promotes flexibility. It's all easy peasy. Thank you for joining us on Smile with Pediatrics. Please remember to like and subscribe to our YouTube channel.